All right, we're gonna go ahead and show you guys how to take care of trigger points of the subscapularis muscle. So the origin of the subscapularis muscle is on the subscapular fossa. So our shoulder blade sits just like this. Just on the front side of the shoulder blade is where the subscapularis fans, and its insertion point is the only rotator cuff muscle to insert onto the lesser tubercle of the humerus. And the subscapularis is the primary internal rotator of the humerus. So in order to stretch this one, we're going to want to externally rotate the humerus. And I'm gonna have the patient actively move for this one. We're gonna lift the elbow just a hair away from the side. This is just so I can kind of get into the crook of her armpit. I'm gonna have a hand directly over the top of her shoulder. This allows me to create pressure from doing trigger point with this hand and to push back into it. That way she's more stable as I'm addressing the trigger points in this area. So she's gonna keep her elbow just like this, and you're gonna internally rotate and externally rotate. Just go ahead and move that through that range of motion for me, Kristen. Perfect, keep moving for me. And so we only have access to a small amount of the muscle, whatever part of the front side of the scapula that we can kind of get to. And I'm just creating that pressure with those two fingers on my right hand and giving pressure on the back side of the shoulder here as well. I'm working along the length of that muscle to the best of my ability. I find that most of the trigger points are right underneath of the humerus or on the anterior aspect of the humerus as I'm working on the subscapularis. Perfect.